Could I welcome the panel to the stage, please? This is the first of two panel sessions that are going to look at the development of clean energy. The first panel session is going to look at clean energy in the NHS, and the second panel session is going to look globally at the issue of sustainable energy. I would like to start just to say that I think that this is a very timely meeting. It was only last week that Ed Miliband announced the new initiatives for net zero with the government, particularly focused on energy. So this is an area that we certainly need to address. And the government have announced there is £800 million on the table from the 1st of January 2025 to 2028 for public sector engagement with sustainability. So this is a good time for us to look at this. So in terms of this first panel focused on the NHS, we are going to try and look at the simple question of could we and should we introduce clean energy through the NHS? And I'll start by welcoming the panelists. And my great pleasure, Kate, would you just like to introduce yourself?
Sure. Hi, everyone. My name's Kate Ashworth. I'm Energy Infrastructure Lead at Energy Capital. We are part of the West Midlands Combined Authority, so a local government body. Energy Capital is an interesting organisation because it's the energy team of the CA, but it's also a partnership in and of itself, so recognising that people like the NHS have a huge role to play in terms of shaping the energy infrastructure for our region. So we're very much kind of taking on board those views as we go through our partnership.
Thank you so much for coming, Kate. Welcome.
You're welcome.
Matt?
Yeah, hi everyone, it's Matt Bozeman, Chief Executive of Birmingham Women's and Children's. I also have another hat on, so I chair the Green Board for Birmingham Solihull Integrated Care System. So get to see it from both a provider point of view, but also chairing across the system around our greener plans and sustainability planning.
And they've kept it simple for me. Matt?
Far too many of us. Our mother should have been more imaginative, shouldn't she? Matt Metcalf, the hospital executive for the Queen Elizabeth Hospital, literally just across the road from here, and a large chunk of University Hospitals of Birmingham. Thank you.
Excellent. And David?
Good afternoon, everyone. I'm David Hanna. I'm the Deputy Pro-Vice Chancellor for Sustainability here at the University of Birmingham. I'm also Director of the Birmingham Institute of Sustainability and Climate Action. My background is I'm a Professor of Hydrology and UNESCO Chair in Water Science, so you should definitely keep me away from surgery.
No comment. Hugh, much mentioned here. Hugh, welcome.
Thank you very much. Well, I'm the same bloke who was here this morning, so I think you've heard.
Were you here this morning?
I was.
Good. Welcome, everyone. Now, look, could everyone move their mics a little bit closer just so that we can hear everyone? Thank you. So I think this is a fantastic panel to address this question because we have got the representation of both the university and the hospitals across this campus, and we've got representation from the local government so that we can align our thinking to this issue of clean energy. So, Hugh, if I could start with you. I was hoping I wasn't sitting this close because you might hit me, but just devil's advocate, if I could,
Okay.
if I could just be a little bit naughty.
Okay.
Why would we be looking at clean energy in the NHS? Surely we should focus on patients. Is this really the right way to go? I'm just going to move on.
Okay, I'll accept the challenge. So this is about patients, of course, that's what we've got to remember. If we don't sort the climate crisis out, everyone's dead anyway, so let's just put that front and square at the beginning. You're right, though, that the challenge comes with people saying, well, look, we're only 5% of greenhouse gas emissions, even if we've got rid of all of it, it's 95% left, why would we bother? But globally, we're 11.2% of global domestic product. And if you add in buildings and IT, we're probably 17%. If you add in consumer healthcare products like Durex, Dettol, toothpaste, soap, we're much more again. If the healthcare sector moves, everything moves. We've got such enormous economic power. And on the specific element of power, if we use monies within the system to decarbonise, we change the grid infrastructure for the better, and we can act as hubs for the community around us for the decarbonisation and electrification of the grid. So we're in pole position to deliver the change.
And I think do you mind? I think it's even more than that.
Go.
I think that we actually are in a position to provide leadership across beyond medicine for change and development, for positive development in society. And of course, the NHS, bless it, is a national network.
Right.
So it actually is a framework within which change can be implemented. So there is a real opportunity to transform.
You're right, we're a constrained ecosystem, and we're beneficent. So no one who works in healthcare will accept collateral damage for the lives they save. So you're right, we're beneficent and we're networked and we're cohesive and we're relatively constrained.
So
we
I
can-
actually think it's completely consistent with our ethos. That's what I would say. We're trying to benefit society by making patients better. We're trying to benefit the whole of society by stopping people from getting unwell. So there is a win-win there.
Totally agree.
So perhaps I could push you a little bit further, because it's my way.
Okay.
I think, unfortunately, the NHS is also quite split up. So you have independent trusts that have managed their own finances and budgets.
Right.
So actually, is that a problem, or is that an opportunity that we've got this kind of differentiated system, financially differentiated?
Yeah, actually, you're so right. The NHS is a federation, isn't it, of independent traders, essentially, now. In this situation, I think it's an opportunity, because a bit like a COP negotiation, trying to get 190-odd countries all to agree to the same thing at the same time, it's a bit like the changing in data management we try to get in the NHS. You try and do the whole thing at once, you'll never get there. The opportunity here, let's think about the power decarbonisation. Let's imagine Birmingham or another major hospital is able to change the Treasury rules, get a power purchase agreement in place to get power purchase agreements where you buy the asset that generates the electricity. So that puts new to ground power in the grid and changes that. Demonstrate it in one place and produce the recipe, everyone else will bake it. So I think this is the great opportunity. The dominoes will fall very fast.
And we could try multiple models in different places and see which one's working better and then take those up.
Absolutely right.
So that could actually accelerate change and accelerate learning.
I would think that if a big hospital, if it was university, the hospitals in Birmingham, for instance, would make such changes, I would be surprised if that hadn't cascaded throughout the whole of the 4 nations within 18 months.
Wow.
Things can change very quickly.
Yeah. So, Kate, if I might bring you in.
By all means.
I think it's quite clear that the NHS really could play a leading role in this change and be a force for change and a disseminator of change. Mm-hmm. But without political engagement, we can't move forward. It's not something we can do unilaterally. So is this vision aligned with the local authorities, with the combined authorities, with the mayor's office? Is there some way that we can make sure we're harmonised in our thinking?
Absolutely. So I completely agree that the NHS has a huge role to play in terms of placemaking, and that's the other advantage of that sort of more federated approach, is it's really understanding the local issues, the local benefits, how you share and optimise that outside of the kind of the traditional boundaries, essentially. Yes, is the short answer to your question. There is a lot of alignment there. We are refreshing what we call our regional energy strategy, which is a document that we use to kind of drive our priorities in terms of kind of the strategic spatial planning that we need to do in order to ensure the underlying infrastructure is there and ready to accept, when we invest in assets, that we have a landscape that will allow us to do that and not form a blocker to that development. So we have that strategy in place. Absolutely, placemakers such as kind of hospitals, university campuses, because there is such a density of demand, form huge anchor loads, which is the flip side of the coin of the kind of big push for generation. Actually, you need that demand, that availability to take that power in order to de-risk those investment models. So it's absolutely key, but there is lots of political alignment in order to do that.
Well, if I could just mention Ed Miliband again, his announcement last week, one of the things he focused on was easier linking into the grid.
Yes.
Is that something we could exploit locally?
Absolutely. So,
could you explain that to me? Because I'm a very simple soul.
Absolutely. So the grid, or the national grid, has been designed from a kind of top-down perspective. So we're used to having centralised power generation. The grid has to change in order to get to net zero to accept a kind of bottom-up input from renewable generation. A lot of that, the vast majority of that will be coastal, so be big offshore wind farms and big kind of generation opportunities. But what we need to do on a local level is get the grid to accept smaller generation, which essentially allows us to have this distributed grid and for the grid to be optimised in a much better way. And that is recognised. So Chris Stark, who leads the Clean Power Mission, absolutely, as reflected in his outputs, that demand is just as important as the large-scale generation. And we've got innovation projects, which essentially allows us to map and to see the opportunities so that we can start to work with partners such as yourselves to see where are the hotspots, where are the challenges, where can we look to overcome those.
So let's just push that a little bit further. If I, as an individual, want to link into the grid because I want to put my little windmill on top of my house into the grid, that realistically, that's not going to go ahead.
Well, firstly, don't put windmill on top of your house, just because of the wind turbulence, that it doesn't generally work. You could put a solar panel on top of your house, and if you keep it below a certain threshold, you don't have to worry, you could just tell the grid you're doing it. If you're putting larger amounts of power in, you have to ask for permission. If you're lucky, there'll be grid infrastructure there to allow you to do that. If you're not lucky, then the grid will say, no, you can only put a certain level, or you can put it in at certain times of day. And that's the opportunity, because the grid is becoming smarter and it knows how to accept the kind of peak power or peak generation and where it can kind of offset that. So as we get smarter, as we go through a kind of digitalization process, actually we'll be able to accept much more renewable generation onto the grid.
So, forgive me this pun, there is power in scale. So if we actually look at this campus as a whole, and we talk to the grid as a whole and say we would like to become a heat zone that we could work together, is that something that could be viable?
Absolutely. So the more that we can get a kind of strategic view of where we think that demand is going in, the better that we have to evidence that the grid's own forecast. So we know that £6 billion worth of investment is going in from our distribution network operator across the next 5 years, just across our region. That's not nationally, that's just across the kind of West Midlands region. Wow. £6 billion they're looking to kind of reinforce the grid, but we need to tell them where they should do it. At the moment, with that interaction isn't happening in a regular enough way or in a kind of granular enough way for them to know where to put that investment that helps us to achieve our goals at the same time.
So there's a kind of vision there, if I could put it, that if we could work across this whole campus with the university and the major trusts on site, we could actually speak to the grid and do something quite innovative and really raise the profile of what's going on in the West Midlands, perhaps lead in this initiative as the NHS and the universities should be doing.
Absolutely. And I would say it's not just generation as well. It's a holistic view across the energy as well. So we should definitely be thinking about getting into kind of larger heat networks as well, which is this kind of cross-vector way that we can look to kind of balance power, heat, and all the other decarbonisation that we need to do as well. But the more demand you can bring together and present with that collective voice, the stronger that advocacy is, the more we can strategically plan for it and the better the outcomes.
Right. So I think that is what we like to call it as a call to arms, isn't it? That's something that we should strive towards.
Yeah.
Thank you very much. Matt Bozeman, welcome. Over the last 2 years, I think we need to get this out of the way, that he knocked down my wife's office, so this is personal. but no, seriously, the renovation has been done at Birmingham Women's Hospital site. You've used a big grant from the government and you have innovated in terms of the heat production. Do you want to say a few words about that?
Yeah, sure. I mean, it was an enjoyable afternoon knocking down the office, though.
Retired because of it.
Yeah, so, I mean, we're kind of just coming the last 6 months into a major programme of investment. So we're spending about £74 million on decarbonisation through a mixture of a very large individual grant, 58 million, and then in a kind of balancing. Broadly, we're spending about £68 million of that of sticking ground source heat pumps in. I would start off by saying it's not in brand new buildings, it's in a 1960s building large on the women's site, a mixture of new build and grade 2 Victorian building in the city centre. That's going to take out about 12,000 tonnes of CO2 out of our kind of footprint, about 80% of our kind of heat and power. I guess the things I'd reflect, though, it kind of ties some of the kind of the points earlier, really. That's one trust having to go through quite a complex programme of kind of bidding for that in the way it is. there's absolutely something in scale here and how we kind of collectively can kind of start to join stuff up. How we get better value for money, I think is an important kind of point, and when we start thinking about campus solutions. And also within there, some of the things that have been real issues for us, and I guess goes back to kind of some of the stuff you touched on earlier, how you navigate the world of NHS capital rules. And I won't bore people with here, it's a nightmare. But actually, if we get into partnerships with commercial partners, universities, and so on and so forth, I think that starts to allow us leverage into a way that makes that much more sustainable. Because it is incredible if you think of how much we've had to spend to start scaling that up on piece by piece by piece. And so I think there'd be kind of lessons learned. So I guess for me, the other really big thing from the NHS, and it goes back to some of the opening questions, why you're doing this, you know, the values about this, it actually is about healthcare. In my organisation, it's about outcomes for children because of poor air quality. You know, that's the kind of back end of it. That's really important because when you get into difficult times like winter and you've got other pressures, it's very easy for organisations to kind of park it. And so how you kind of hold that, and I think, again, you've got much more likelihood of sticking the course if that's a collective vision, a collective ambition, whether that's as a city or a region. So there'd be kind of reflections around it. You know, really happy to share stuff outside as well. I mean, it's a massively complex building scheme, but a huge programme of work. And yeah, so as I said, ground source heat pumps, about £3 million on solar, about £1.5 million on intelligent lighting. So that's pretty much going to remove the vast bulk of our heat and power kind of carbon footprint, which when you think of the age of our buildings, I think something we're really proud of. So yeah.
Yeah, well, I think it's a great initiative, and congratulations to you for getting it off the ground, or underground, I should say.
Underground.
But you also have your integrated care hat. And the integrated care boards are a way of working across trusts, and I think Hugh was alluding to the fact that we should be able to disseminate this learning and more rapidly propagate it. Can we develop a role for the ICBs in this process?
Yeah, so I think there's a few, so if I give some practical examples of some of the things we're doing actually. So again, one of our lessons learned is you've got to be really smart about measuring, because if you don't measure your actual proper footprint, start to track it, you really don't make progress. So how do we start to measure as a kind of system across healthcare? How do we start to support training and education? And that's right up to the board level actually of why this matters, why it's important. Then there's some real practical things. So how do we develop joint estates plans? You know, how do we develop shared plans around different topics, but something like medicines management? So how do we develop our kind of collective planning around that? And then there's a very hard edge to this. So how do we combine things like capital allocations and start to pull that in a way that makes sense? If we're going to do something creative, with a commercial partner, how to do that jointly? And I guess the challenge at the moment is a lot of the stuff is kind of distributed down to individual organisations, and we've got to pick that back up, I think, now to maximise some of the opportunities. So that would be my sense of opportunities, but I think it's quite important we get this timing sorted now, because some of the opportunities are going to come down the track really rapidly. I guess the final reflection, Dion, it really depends to some extent on how mature that individual system is, what the relationships are like, and you can't underestimate that. I think we're lucky in Birmingham, we've got good relations in health, and we've got good relations with all our university partners, so I think we've got really good conditions for that.
There's an opportunity there.
Opportunity.
Thank you. Matt Metcalf, thank you so much for coming. Also, you've already got initiatives underway. You have a very complex system of hospitals that you work within in terms of UHB. What kind of developments are underway in terms of clean energy in your trust?
Thank you. And if it's all right, I will illustrate using the Queen Elizabeth Hospital just simply because it's, A, because it speaks to the campus solutions that we are all beginning to form in our minds, and B, because it's a patch I know best. I suppose the first thing to say, and probably always important, essential but not enough, is that we have a plan. So we have a plan to get to decarbonise our hospital, to get to net zero. And it's a plan with a fairly eye-watering price tag, about 168 million at today's prices. And I guess the main issue with plans is really making it, particularly for those who have seen enough of them come and go and sort of sit on shelves and never really achieve liftoff, is to get on with them. And to your question, currently we are to deliver a plan of that magnitude to get to net zero for a hospital as big as the Queen Elizabeth. It's multifaceted. It will be what David Brailsford might call the sum of small parts. with a few chunky ones thrown in. So, for instance, at the moment, we're replacing a whole load of windows and we are insulating wall, nothing fancy, the kind of stuff we all do in our own homes, just a bigger scale. We're also again, it can also be done domestically, but the goodness gracious me, having visited the plant for the air source heat pumps, they're a bit bigger than those in an average home. And all of that's being generously supported by the public sector decarbonisation scheme. I think it's a tranche 3B or whatever latest round it was, for 12.9 million. It would be probably sensible to draw out at this point. I absolutely echo a lot of what Matt was saying resonated with me. We've got a very mixed heritage estate. So when you look at the Queen Elizabeth Hospital, every time we're on the naughty step for something we allegedly did, and it comes on the news, you see these beautiful, iconic, free oval towers in the backdrop, and they're amazing. They're built to 21st century building and efficiency standards. We've got really good relationships with Consort and Equans, our PFI providers and suppliers. And that's sort of not really the issue. The issue is the heritage estate. So all that work that I just illustrated examples of, that's all treating the heritage estate. And heritage is a nice word. It makes me think of funny-coloured beetroot and carrots. But what it really is a bit of a euphemism for falling down. So we have, sadly, we have buildings, we have people in offices with roofs that leak, and it doesn't, I'm conscious that I'm in a room with some surgeons present, but as that is also my own background, I'm allowed to say, even a simple surgeon can work out that when the rain's coming in, the heat's probably getting out. So one of the reasons I think that's important to note is that just to bring our heritage buildings up to modern acceptable standards has got a price tag somewhere probably north of 200 million before you do anything on decarbonisation. And for that reason, it's really, for me, it's essential that we can continue to access ring-fenced pots of money. Because if it's not ring-fenced, we're being brutally honest, given the
it's inevitable it gets pushed towards direct, immediate patient benefit, waiting ambulances, as Matt was talking about earlier. So I think that's absolutely right, yeah. So, okay, we're a big campus, and we've got the university with us here today, and thank you, David, for joining us. With your Pro Vice Chancellor of Sustainability hat on, is there innovation going on across this campus that perhaps could even be disseminated and evaluated within the NHS?
I think absolutely, and there's some incredibly strong parallels. So we have the same timeline for our net zero goal of 2045, and we have very much a heritage estate, so I think there's a lot of sharing to do. Yeah. Clearly, we already work with the hospital in terms of research, and the Birmingham Institute of Sustainability and Climate Action, as we discussed this morning, helps to sort of unsilo a lot of the activity we've got across different disciplines, but uses that for change in the real world. Also, we already work a lot around this education space, and sustainability is one of our graduate attributes. We expect, no matter what discipline people are graduating in, that will be something that's embedded in their programs, not as an add-on. But in relation to your question, particularly around energy, I think the university can provide some really good demonstrators and opportunities, because as well as research and education, I think leading by example in terms of our net zero journey is really powerful. So we have been for some time now developing a smart campus, so thinking about ways that we light and heat the campus in ways using modern technology, but also building management systems that allow us to use energy where we need it most at particular times. We are building a new energy accelerator building, which will actually help to develop some of these technologies and think about how we apply those at scale. We're also trialling a range of activities in our heritage buildings, and part of our campus vision for the future is about how we make this campus and its great heritage more sustainable into the future. But I think there's a lot of knowledge sharing to happen. It's been picked up by many of the aspects of the panels around some of how we can work together on some of the technical challenges about whether that's connecting to the grid, some of the technological limitations, some of our joint influence around aspects of regional and national policy around the net zero transition. But importantly, I think, and seeing the people on the stage, it's also about leadership. And we heard the discussion this morning around individuals making behavioural choices and changes. But I think that comes from leadership from the top. And a really important point was made also about tracking, and are we getting better at this? I go out and speak to people across a whole range of sectors, universities, industry, and indeed public sector organisations in their own net zero journeys. It's how do we track this? How do we know we're getting better? But I think there's a huge opportunity as innovative organisations to both show thought leadership, but also to work together and think how we can lead through practice as well.
So shared learning is clearly a big message there. We shouldn't be working in silos. But there is also the opportunity to evaluate innovation within the NHS, to exploit this campus. And as we've seen today, the activities of this group is to evaluate benefit and patient impact in terms of these transformations. So I think we should close for time now, but it's been fascinating to listen to the different views. I would finish with this thought. I think we have a unique campus that crosses the university to the hospital, to the NHS and to the wider community. We could put ourselves in a very strong position in terms of innovating and leadership, not just locally, but nationally. And I think we should exploit the advances that have been made in the university, which has been recognised as one of the leading sustainability institutions in the country. So to all of the panel, thank you very much for your views, and thank you for listening to you today.